Welcome to Money and Medicine. Today we are going to talk to Discovery a little bit about medical aids with a specific focus on the difference between a medical aid and a hospital plan. We'll also look at some unique features that they offer. If this is the very first time that you are joining this channel, welcome. We hope you find it useful. Please go to the bottom of this page and hit the like button if you find it informative and something that adds value. And also go to the bottom, subscribe to the page for future content. Thank you so much. Today in the studio, we've got Ronnie Goodman. Ronnie, I know you hit the golf ball a mile and a half. So other than playing golf, how did you get into the industry? What is your background? Tell us a little bit about yourself.
I actually got into the industry more through a friend that I studied with. So I initially started off as a teacher or studying teaching at University of Johannesburg.
Okay.
And I quickly realized that it's slightly more lucrative to be in this industry. So I studied business management then. And a friend approached me one day. I was working in the construction industry as a project manager. And he said, listen, I've got a position available. This is the qualifying criteria, and would I be interested? And I must say it's been very good ever since. And I've been at Discovery for almost 6 years now, and I have really enjoyed the process.
Ronnie, as you know, Stefan and I focus predominantly on medical professionals. And the reason why we created this platform is to share information with medical professionals in such a way that they can easily understand the information and ultimately to help them make informed financial decisions. When it comes to medical aid, we've experienced that there's so many plans available in the market, and there's a lot of different service providers. At Discovery, for an early career doctor, what would you say is the most recommended plan and most popular plan for a young medical professional starting in the industry?
Okay, so the question, I almost want to take a step back with the question and say, at Discovery, we truly value the relationship between the broker and the client. You know that client quite well, and you've done a medical F&A with that client. So you know the client's needs and the budgetary requirements for that client. So it's very important to almost start with that process first.
Yes.
We offer 23 different plan types, and this is anything from your executive plan, which is your high end for your high net worth client, right down to what we call a key care start, which is a capitative plan, which looks at your income band and prices you according to that. And within that, we believe that we can find the best suit to your budget as well as your medical requirements. One of the plans that we found that is very good and we see a very high take-up in, especially with younger clients, is a plan that is tailored towards that kind of market, and we call it the SMART plan. What the SMART plan tries to offer clients is a fairly young client that's fairly healthy. He wants to know that he can go and see a GP, or if something goes wrong, he needs a TC biokinetic or something, he can, but he's more focused on having the hospital portion of it. If there's an emergency, will he be fully covered? So what we've seen is a trend that we've got a large take-up, especially with our younger professionals in that area.
Oh. Ronnie, so on that note, I know the term between a hospital plan and a medical aid is thrown quite around. Just in very high-end layman terms, what is the difference between a hospital plan and a medical aid?
Okay, so there's actually three that runs around. It's more like a hospital insurance, a hospital plan, and then a medical aid. Hospital insurance is something that pays out when just almost after the effect. You spend an amount of time in hospital, and then we'll pay out a certain amount per day. A hospital plan that we see quite often is something that just covers you for in hospital. Now, very important in hospital, and this is where a bit of confusion comes in, is there's a difference between going into triage, which is your casualty ward, and going into a hospital. The easiest way to see it is that the moment they put that little hospital band around your arm, then you are in hospital. A hospital plan covers unlimited amount while you are in hospital. The little band is clipped around your arm, but will not cover anything outside of that process. A medical aid will cover outside of that process as well. So the hospital plan portion will be very similar. We'll cover unlimited in the hospital up to 200% of medical scheme rates, but the medical aid will also pay for day-to-day requirements. I need medicine outside of hospital. I need to see a GP outside of hospital. I need to do whatever outside of hospital. And that is the key difference between the two. The one is purely focused on what happens when I'm in the hospital. The one focuses on in the hospital and outside of the hospital.
Ronnie, we've seen actually quite a move into the hospital space where a lot of people are compromising on a medical aid, or they're moving down to a lower plan, or like I said, even sacrificing a medical aid and moving into the hospital plan section. Is that a trend that you've also experienced? And what other factors should people take into consideration when they want to make a decision like this?
I would say yes. With the changing times, we have seen a bit of a trend in that. We've also seen a trend where clients move to, like I said, the smart plan, where you might not have a full medical aid where you have got a savings plan, but there are some day-to-day benefits provided. I think the most important thing there is to consider, and once again, your relationship with the advisor is very important here. There will be clients that'll be benefited by purely going through a hospital plan and having the discipline to save that money for events outside of hospital. Generally, what we find is clients prefer to have some sort of certainty outside of hospital, even if it's like on the smart plan as little as just doing a GP visit and having one or two benefits, or on one of the lower plans where there's something. But we do find that there is a trend towards that where a client still wants some benefit outside of hospital.
Correct, yeah. Ronnie, on that note, something that we get confronted quite often with is when clients opt for a hospital plan, I think one of their biggest concern and a lot of questions that we get asked is, especially from female clients, is when they have opted for a hospital plan, how is that going to affect maternity? Because as you know, as soon as a client becomes pregnant, there's certain scans and consult that needs to be done. Is a hospital plan still going to cover that, or how's that going to affect them?
Okay, so very important. On all discovery plans, we have a maternity benefit and a fairly rich maternity benefit. Just a little bit of background on how the maternity benefit works is once you know that you are pregnant, you will register on the plan, and we will provide, depending on the plan you are, between 8 and 12 consultations with a GP or a gynecologist. We will also pay for all the basic bloods surrounding that. We will also pay for the actual maternity event in hospital, and we'll pay for 2 follow-up consultations afterwards. That basket of care is provided through all discovery plans. What is important for a person to know is, firstly, that they register on a plan before they fall pregnant.
That was my next question.
Because what will happen is, if they register on a plan when they are pregnant, they might have exclusions or waiting periods that might exclude a lot of that from being paid. So it's important to, if you're planning to get pregnant, to get onto a medical aid first.
That's the registration of basically joining a medical aid before you get pregnant.
Exactly. Right? That's joining Discovery or any other competitor, but being on the plan before you actually decide to fall pregnant is very important. Okay. I think what's also important to note then is that even though you have this basket of care with all the maternity benefits on all the plans, there are outside of hospital costs associated with any pregnancy. There might be additional bloods that needs to be done. There might need to additional medication and vitamins that need to be taken within that period. If a client decides to go on a hospital plan, even though they will have the exact same maternity benefit, any of the outside of hospital costs or outside of that basket of costs associated with pregnancy will then be for that client's pocket.
Okay. Ronnie, if and this is a bit of a technical question, but if there's a client that is on medical aid X, already pregnant, and wanting to move over in order to utilize the discovery pregnancy benefits. In other words, there's been no break in medical aid. Will that be allowed or not?
Yes, as long as there's no break in membership. That's very important. So underwriting requires that the moment there's a break in membership, we will apply underwriting.
Sure.
What we might do is we might apply a 3-month general wait.
Okay.
But that will be the max as long as there's no break in that membership.
Okay.
Then, Ronnie, on that maternity benefit that you've mentioned, or the pregnancy benefit, is there a specific time that you have to notify Discovery within that you are pregnant to register that benefit?
So there's no specific time frame that we say it needs to be within a week, but we do recommend as soon as you know. What normally happens is you will think that you're pregnant, you'll do the test, and then you'll go and see a gynecologist and confirms you are pregnant. The moment that happens, you need to register for it. So generally you'll find your first consultation is out of pocket because we don't know whether you're pregnant or not, and that gynecologist will confirm it. We just recommend as soon as you know, because we won't backdate any of those payments. If you do it on a later stage, we're not going to backdate any of the visits until you've registered. So it's very important that you do it as soon as you can.
Ronnie, you mentioned a waiting period. Thanks for sharing that as well. You mentioned a waiting period in your previous statement. What is meant by a waiting period, and what other penalties can be imposed, if I can call it penalties, for someone that hasn't been with a medical aid, or that there's been a break for longer than 90 days?
Okay, so waiting periods are methods or systems that are put in place to protect the members of a medical scheme. What you will find is that in some instances, it doesn't happen often, but it can happen, that a member has not been contributing to a medical aid. Now they find out they've got a condition and they join purely for that period. And once the condition has been paid for, they lapse the membership and go without it. That is unfair to paying and contributing members that have been contributing to the pool for an extended period of time, to make sure that if something happens, there's money available for them to pay. Waiting periods are imposed just to protect the scheme as well as the members and make sure that the scheme remains sustainable, and to prevent anti-selective behavior where a client might never have been on a medical aid and just before now they find out they're sick, now they join the medical scheme and deplete those funds. The types of waiting periods that you'll find is you'll find a 3-month general waiting period, you'll find a 12-month condition-specific waiting period, and you'll also find what we call a late joiner penalty, or LJP. What a 3-month general waiting period means is, for any elective procedure, we will exclude you, meaning I have to go for a shoulder operation, I have to wait for 3 months before I can go for that operation. But if I'm in an emergency and I need emergency care at a hospital to save my life, I still have full cover.
So you can still, let's say, for instance, you're in a 3-month waiting period, on your way to work, you're involved in an accident or you become really ill, you can still go to hospital and you will be treated in full.
Definitely. So you'll see very clearly, it'll be marked on your policy schedule that whether you are excluded with PMBs or without PMBs. Now, PMBs are what we call prescribed minimum benefits. These are benefits that every single medical scheme in South Africa has to cover a client for. We can exclude a client without PMBs for a period of 3 months, meaning they've got absolutely no cover. But normally what you'll find is a client will have a 3-month waiting period for elective procedures, but he will have access to PMBs, meaning in an emergency, you can go to the closest nearest hospital and you'll be covered fully.
And those PMBs, those prescribed minimum benefits, that's across all medical aids. So they have to basically cover those certain conditions within that 3 months.
Exactly. That's prescribed by the Council of Medical Schemes for all South African registered medical schemes. So regardless of which company you are, you have to cover those, I think it's 27 chronic conditions, exactly the same way.
So what we've done is you can go to the Money in Medicine website at www.moneynmedicine.co.za. Under the resources tab, we will put a link to the prescribed minimum benefits. So if you want to know what is listed on the prescribed minimum benefits, you can find those conditions in there. Ronnie, something else that I wanted to ask you is, you mentioned earlier that in certain events, you might have a 3-month waiting period where prescribed minimum benefits are also excluded. When would that happen?
So those are for members that have not belonged to a South African medical scheme for a period longer than 2 years and had a break in membership more than 90 days before coming onto a medical scheme. So those are for clients that have really not been a part of a scheme whatsoever.
Sure.
And there's been a long break in membership and then they move on to the scheme. And it's purely as a protective measure to say you will need to wait at least 3 months before you can start claiming on the scheme.
Ronnie, I know a lot of people are always looking for ways to be a steward of their money and to save on premiums. How does Discovery Health help their members for effective ways to still have a comprehensive solution in terms of cover, but they can also save in terms of premium?
It's actually quite a good question. When we've got what we call network hospitals. So on the smart plan, we've got what we call a smart network. On the coastal plans, on the coastal regions, we've got what we call a coastal network. And on the inland regions, we've got what we call a delta network.
Okay.
All this means is Discovery has negotiated preferential rates with certain hospitals. And they will pass that discount rate onto you as a client, that additional saving onto you. What you can then do is look at what hospitals are covered within your area. And the plan will be exactly, and I'm just going to use like the classic Delta Saver versus the classic Saver, where the plans are almost identical in what they cover and what they provide. The only difference on the classic Delta Saver is you need to use the Delta Network Hospital list.
Okay.
And for that, there's a considerable saving in your monthly premium. Very important that if in an emergency something happens to you, you will still go to the closest best hospital and be treated fully. And only once you're stabilized will we offer to move you to one of the Delta Network hospitals.
Okay.
Ronnie, what happens in a situation where you have a condition? Let's say you need to get a knee replacement, but there's an exceptional specialist at an hospital that isn't in that network. Can you still go to that specialist? Is there a penalty that you pay? How does that work? Or is it completely not an option?
No, you can still go to that specialist. And I'm talking under correction, I think that's 9,750 Rand is your copay.
I think it's also just very important to mention to the listeners that might be the co-payment at this specific time of the episode.
But it can also...
It's not subject, and it's not a given, because this episode is going to go onto the platform. It might change at a later stage.
It definitely, and it changes every year in line with the increases.
So there's a co-payment.
But there's a co-payment. So if you decide I'm on a Delta network, but I need to use this specific doctor, you can use him, but there will definitely be a co-payment involved to use him.
So, Ronnie, this brings us close to the end of our episode, but just before we let you go, why Discovery? Why would somebody, if I was a client looking for medical aid, why would you recommend Discovery?
So there's a few reasons. And I'll start with, I would say, just the financial stability of the company. We're currently the only AAA rated credit rating medical scheme in South Africa, and we're also currently the largest medical scheme in South Africa. The reason why this is important is that no matter what, we will be able to pay your claim. The reserves are currently sitting around about 26 billion Rand.
Sure.
And once again, this is not profits. This is a pool of member funds, meaning regardless of how expensive your claim is, we will be able to fund that claim. And I think that should be very important to look at. The next process is our advancements in technology and our networks that we've got with hospitals. Because of our sheer size, we have got a very wide network of hospitals and pricing arrangements with doctors. And that makes us very accessible to clients and very cost effective to clients. One of the last things is also our advancements in technology. We assisted in creating a COVID app that measures who's been in contact with COVID. We're also assisting with what we call the Taito home device, where if you need constant medical attention, you can have a device that can do very, very accurate assessments, and you can get into contact with a doctor immediately. And that actually reduces the cost of not having a nurse permanently in your house. Sure. So a lot of these innovations and advancements that we have pioneered within the industry, I would say, is what makes us such a good offer to your clients.
Ronnie, thanks so much. I think that was very valuable. This was very insightful as well. I've got no doubt that when a listener listens to this episode, they will have a good understanding of what Discovery Health is about and also how to identify the correct plan. It's also very important to mention to you that, like Ronnie have mentioned, it's important to sit down with your financial advisor. There's certain aspects and factors that you have to consider when you identify whether you have to go onto a medical aid or a hospital plan. Both Stefan and myself are accredited with Discovery Health. So if you do not have a financial advisor that you are engaging with, you are more than welcome to reach out to us. You can also go to the Money in Medicine website. There's a Talk to Us tab. Please post your question on there and we will be in touch with you. If this is the first time you are listening to this episode and you found it useful, please also share this with your friends and colleagues, and hit the subscribe button and like this episode. Until next time, plan.